Good morning, dear students. Today we'll discuss physiology of electrocardiogram, part 2. It's competency PY 5.6. Objectives of today's lecture is what are the different leads of ECG and what is Enthoven's law. In the previous lecture, we have seen that normally there are 5 waves of ECG. This is the number 1 wave called as P wave, which is caused due to atrial depolarization. And once atrias are depolarized, now they are a stage of plateau phase. That's why you get a straight line in the ECG, which is visible here and this very small. After that, impulse will spread to the ventricles through AV node and bundle of his, and there is depolarization. As we remember, it goes to the interventricular septum, then to the whole ventricle, and finally last part of the heart. So like this, three waves are formed: P, Q, R. P is by atrial depolarization, QRS complex is due to the ventricular depolarization. Again, after this, whole ventricle will get depolarized and the ventricles will go in the plateau phase and you get a straight line after the S. And lastly, the ventricles start to depolarize in the reverse direction, you get T wave. So this is the complete ECG. Again, after depolarization, slight phase of rest will be there till the next beat comes. So like this, we are having 5 waves P, Q, R, S, T. So these are the different ECG waves. This is called as a PR interval, which is from beginning of P wave to the beginning of QRS complex. It is normally 0.16 seconds. This is the QT interval, which will indicate the ventricular activities, depolarization followed by repolarization. And these two RR intervals are used to find the heart rate. Now the question will come, why we want to know heart rate from the ECG? Under normal conditions we don't need, but when there are ventricular arrhythmias, atrial arrhythmias, or when ventricle is beating fastly, that time we should know the normal rate of ventricle during fibrillations, flutter, so that we can differentiate. So RR intervals are used in the ECG to find the heart rates. So this PR interval from beginning of P wave and the beginning of QRS complex. This period is PQ interval. Normally it is 0.16 seconds. So these are the different durations. PR interval. Average it is 0.12 to 2.2. This will indicate atrial depolarization and conduction through the AV node. QRS duration is 0.08 to 0.1. So this indicates ventricular depolarization and atrial repolarization. This QT interval, which is normally 0.4, which will indicate ventricular depolarization plus repolarization. And lastly, the ST interval. This indicates ventricular depolarization. So like this, normally we can detect these durations. So now we'll meet to the next important topic, that is how to record an ECG. So we are using different leads. Now what is a lead? Lead is a combination of two wires and their electrode to make a complete circuit between the body and electrocardiogram. So that current flowing in the body will flow through the machine and it will pick up the different potentials coming from the heart. So now there are two types of leads. One is a unipolar lead, others are the bipolar. So through these two we are recording the ECG. Unipolar, as the name indicates, active or exploring electrode connected to an indifferent electrode at zero potential. So only one electrode is active in unipolar, and in bipolar, by using two active electrodes, record the difference in the potential between two lengths. Now electrocardiogram amplifies the heart electrical signals. So whatever electrical activity happening in the heart, they are being amplified by the machine so that we can clearly differentiate the different patterns of electrical current flowing through the heart. So we are recording from 12 different angles. So it produced 12 different tracings so that we can look the heart from the different sides, horizontally through the chest leads and vertically and anterior posterior through the limb leads. So by 12 different combinations. So ultimately basically our purpose is to find it out what is the site of lesion, site of damage, site of focus. So each limb and chest electrodes record slightly different electrical activity because of the difference in its position related to the heart. So we are connecting the two limbs, right arm and left foot. Commonly from these three limbs we are connecting the leads. Now in this unipolar, what we are doing first, these all three are connected to zero potential. So it is called as indifferent electrode. Now active electrode is placed to the chest. So as active electrode is covering the chest, it is called as the chest leads. Okay. Now the chest leads, as we know, heart is located behind the sternum, and if you remember, 2/3 is on the left side, 1/3 is on the right side, mostly behind the sternum, and on the left side mostly behind the ribs. So the position of this leads horizontally is in the 4th and 5th intercostal space, so that we can focus the heart horizontally, some on the right side, some focusing on the interventricular septum, and some focusing on the left side of the heart. So this is called as exploring electrode. Through this we are picking up the potentials coming from the heart horizontally. So these are the location of the chest leads. Lead 1, you can see it is labeled as V1. It is located on the right side, 4th intercostal space. 2 is located on the left on the same, that is 4th intercostal space. V3, V4, V5, V6. So these three are placed in the 5th intercostal space. So all this you can see are going horizontally and picking up potentials coming from the heart. Now in second diagram you can see from here the transverse section. This is our heart. You can see that these first two leads, this is the right ventricle, left ventricle, and this is interventricular septum. So you can see V1 and V2 are looking mostly from the right side, so they will pick up potentials coming mainly from the right ventricles. So in that you can see here R wave is very small and S wave is very prominent in the V1 and V2. Now gradually if you move forward from V1, V2, V3, you can see now the R wave is going on increasing from here, and S wave will start reducing from this. So V3, V4 are looking mainly at the interventricular septum from the left side, and V5, V6, you can see they are concentrating more on the left ventricle, which is more bulkier, more dominant. So you can see the R wave is tall in this too. So this is the typical picture of electrocardiogram if you record from the chest leads: V1, V2, V3, V4, V5, and lastly the V6. So gradually from V1 to V6, R wave is increasing and S wave is reducing. So this is the typical pattern visible. So classically you can remember like this, but here by drawing two lines, gradually R will go on increasing, and here you can see the S will go on reducing. So this is the easy way to interpret the ECG and easy way to remember also R and S waves. So that's why labeling is very, very important. Through the labeling only you can differentiate. Okay. Now the limb leads we make by a combination of right arm, and left leg. So we draw just a triangle across the heart. So this is will indicate right arm, left arm and left foot. So when you put if you keep the electrode here or here, basically the machine will amplify the potentials pick up from the heart. So it is same. So for convenience we are keeping electrodes on here, because it is difficult to keep the electrodes on the shoulders. Okay, so for the convenience we are keeping on the right arm, left arm and left foot like this. So basically it is drawing just a triangle across the heart. So this is the one, right arm, active electrode, this is the exploring electrode, and left arm and left foot. These are two will be the indifferent electrode. So only active electrode means this is the active electrode. From here we are picking the potentials. So it is called as AVR. A stands for augmented limb lead. R means for the right side. So now this will be looking the heart. Just you can see it's looking the heart from this direction. Okay, and we know that the direction of electrical current is like this. So all the potentials are going away from the heart in this. So if you recall the basic principle of recording electrocardiogram, so if the potentials are coming towards positive electrode or active electrode, it will draw a positive deflection. If it is going away from positive electrode, it will draw negative deflection. That's why, see what will happen now. This is typical of AVR. You will get the negative waves. Okay, PV is also negative, this T is also negative, R is also negative in this, or very small in fact, and S is very prominent. So this is the classical feature of AVR, as direction of electrical current is like this. Okay, now on the contrary, if we now will move this exploring electrode to the left, means this will become exploring now. So what will happen, this exploring electrode, this two will be remaining the indifferent electrodes, this and this indifferent electrode. So that means we'll be looking the heart from these directions, just like we are keeping battery from this side. So it will have again a different picture. So like this, what will happen, every time we'll have a different angle of recording. So it is called as AVL, augmented limb lead left. So its recording will be, you can see it is a bit again different like this. And this is of AVF. So by three different angles, through different limb leads, we are recording electrocardiogram. This is called as augmented AVL, AVF, AVR. So current flows in the body fluid, no matter where on the limbs the electrodes are placed. Records obtained are those that would be obtained if electrodes were at points of attachment of the limbs. So basically the machine will amplify whatever potentials are coming towards it. So in this we can see this is a classically AVR, AVL and AVF. Okay, so like this three different pictures are visible based on the from which direction we are picking up the currents. Now bipolar leads, as I mentioned, right arm, left arm, both are exploring, but one is positive, one is negative. So this is called as the lead one, where we are using combination of right arm and left arm. So two active electrodes called as the bipolar limb leads, and the second one, right arm, is done with the left arm, lead 2, and lastly this combination, left arm and left leg. Okay, now in this you can see that in this, when these two are connected, Direction of electrical current is along with this. So this triangle which is formed across the heart is called as Enthoven's triangle. What is clinical significance of this? And Anthony, if you remember, is the father of electrocardiography. He has given us so much how to interpret different ECG. So this leads. So what is the significance? See, this is totally exactly in the direction of electrical current. So when the two difference, right arm and left arm, it will draw. So when you, that means you are picking up from this direction more and this direction. So it is more electric current is like this. Okay, so it is totally will draw positive wave. So this is the tallest, basically lead 2 is tallest, and we will get the perfect electrocardiogram. That's why it is kept as a standard. So always whenever we are looking at the ECG, first look at the lead 2, because it will draw appropriate exactly P, Q, R, S, T, whatever we get an ideal combination, because potentials are in same directions towards the ECG. Lead 3 will be in between, lead 2 gain less. So the Enthoven's law states that the amplitude in the lead 1 and lead 3 will be equal to the sum of these two will be equal to the lead 2. So lead 2 amplitude is equal to sum of lead 1 and lead 3. That is called as the Enthoven's law. Okay, amplitudes of lead 1 and lead 3 is equal to lead 2. So like this, from 12 different recordings, we will try to find it out, the normality of heart and if any abnormality comes. So these are the chest leads which will pick up the potentials coming from the right ventricle, interventricular septum and the left ventricle, and this limb leads will be focusing on the top and sides, and this AVL will focus from the corners. So like this, by a combination of 12 different leads, we will try to find the condition of heart, abnormalities, and from where it is arising actually. So just to summarize, we have learned leads of ECG and what is Enthoven's law. So we'll discuss in detail during our flipped classroom discussion. Thank you.